We are in the midst of this incredible technological revolution. Augmented reality is the next logical step in how we view surgical cases. When you can see what you're doing before you do it, it makes it a hell of a lot easier and safer and better. If I look back to before I started using Medivis and to afterwards, every case I've used it on has been validated. I've seen exactly what I saw before the operation in the operation. You've got this platform for incredible depth of information that you can manipulate in space right in front of you. It's a rehearsal before you get in the operating room. You bring a three-dimensional floating image of a patient's pathology to them in a way that makes sense. It took me 7 years of training, 4 years of medical school to learn how to read an MRI on an image. I'm bringing them a picture of their face, and we can move through and show them the pathology. To have this, augmented reality, three-dimensional, dynamic image where we can see the anatomy for what it is, not just a slice in the axial plane, the coronal plane, and the sagittal plane. You can rotate it around and you can window it appropriately. And on top of that, it's layered. So you can take information that we've gotten better at getting and lay it on top of that. Understanding where the critical anatomy is, which in brain surgery is pretty critical, right? If we're talking about a nerve that goes to your swallowing function or your vision or your hearing or your facial function, or the brainstem, which controls your heart rate or your breathing, getting the opportunity to really spend time and see that anatomically where it's going to be, and then navigate in the operating room with this kind of really textured, information-based image, it's impressive, and I think it's safer. I talk about this all the time. When the operative microscope first came out, no one studied the operative microscope to make sure that it was better than not using a microscope. It existed and it was just better. People accepted it. A GPS system is better than a map. A computer is better than a typewriter. With Medivis, the accuracy is there. The precision is there. And so I think that's the game-changing moment. It would be silly not to use this in your practice because it's only going to get better. And so you want to be on that ground floor as the building goes up.